This is a short clip about iconarray.com, a tool made for researchers and clinicians to illustrate risks through pictographs. It has two parts, a homepage for researchers and a separate site for clinicians to use with patients. In this video, I explain how this tool can be effective and what it can be used for. Let's get started with a common scenario. Imagine you've been diagnosed with cancer, you visit with your oncologist, and he lists off a bewildering amount of drug combinations and treatments that have the potential to shrink your tumor and extend your life. But there is a possibility that they may not work, and success can mean a lot of different things. During your visit, your oncologist goes through different treatment options and lists off the probabilities of their success. He then gives you a few handouts, shakes your hand, and tells you that everything is going to be okay. In an attempt to communicate with patients, doctors like yours have used aids to communicate health information, both about the patient and about future decisions that they may have to make. These aids come in all shapes and sizes. Pie charts, graphs, and infographics have all been used. However, I have had the opportunity to design a tool that allows researchers and clinicians to generate pictographs. A pictograph, also known as an icon array, is a type of graph that uses different shapes to symbolize statistics. Unlike a line or bar graph, a pictograph uses a matrix of icons to represent an at-risk population. It simultaneously displays both the number of expected events, the darker region, and the number of expected non-events, the lighter region. The research team that I worked with at the University of Michigan has published many articles about pictographs and their rate of success. Overall, we have found that they are more effective than line graphs or pie charts at communicating risks and reducing biases. So let's go back to that scenario. Imagine you're with your oncologist, who after a few tests sits you down and says you have cancer. You hear these words and your mind goes blank. You think it's a death sentence. Hypothetically, your doctor then starts to go over your treatment options. You hear words like chemotherapy, radiation therapy, immunotherapy, and surgery. He then starts to talk to you about the risks of each option and their success rates. As you talk to him, it becomes clear that he would prefer chemotherapy because of its success rates with your particular tumor. This is just an illustration, but imagine that this is the pictograph that was generated with iconarray.com and that is given to you illustrating the statistics around the success rates of chemotherapy. In this case, 14 out of 25 people are alive in 10 years, as seen in blue. An additional 3 are alive due to more treatment, as seen in green. 4 out of 25 people die from the cancer, as seen in black, and 4 out of 25 people die because of other causes, which can be seen in red. Your doctor gives you similar icon arrays for surgery and for radiation therapy. Looking at surgery, you can see that there are less people alive in 10 years. Your doctor tells you that you can fight this and shakes your hand. As you're walking away from the office, you look at the options and think about what you want to do. Tools like iconarray.com can shape the way we understand our choices. Of course, cancer can be more complex than this. Issues like side effects can play a significant role in our treatment decisions. Friends and family can also have a drastic effect on our decisions and how we approach our medical treatment. However, any tool that allows us to understand those tough choices can help us overcome that initial shock of hearing that we have a terminal illness or chronic condition. If you're curious about the site, feel free to visit it at iconarray.com. If you're a clinician, feel free to visit clinician.iconarray.com for side-by-side graph views. And lastly, if you have any questions about the project, feel free to email me at ramton@umich.edu.